So, Idalina, welcome back.
Thank you.
In this episode, we're going to talk a little bit about children's health, particularly oral health in children. As you know, as part of a multidisciplinary team, we see a lot of paediatrics. We're beginning to see a lot of anxiety and psychological issues in children. And certainly I remember seeing children in paediatric outpatients and A&E departments with such poor hygiene that they had to have their teeth pulled out. And these were 4-year-old, 5-year-old children, which was very sad. So just a little bit about what should we be thinking about as parents of children? How should we be looking after children's teeth? Are there any quick sort of bits of advice that could be of value and help so that they maintain good oral hygiene throughout their lives?
Well, this is a bit controversial, but this is something I stand with. And that is that I feel that if a child can hold a bottle, you should give them an electric toothbrush.
Wow. So,
And I did say it's controversial
whoa.
because in most electric toothbrushes it actually says 3 and above. But let's put it this way. You shouldn't expect a child to brush their teeth unsupervised anyway. By giving them the brush as soon as they can hold a brush, you essentially, they're learning what that is.
Good point.
The noise, what noise it makes, the vibration it makes.
Yeah.
So essentially when they're able to, well, as a parent, when you're able to brush their teeth, it's not going to be such a frightening experience. If you leave it until they're much older, at 3 years old, that's when they've learned already to say no.
Yes.
And no is a no
Yeah.
at that age. So I personally ask the parents to introduce it as soon as they can. There's plenty of toothbrushes in the market and different prices as well. I personally like the OB. When I say personally, it's also research-based. It has been shown to be the most effective. In fact, in the past, the advert for OB was like a dentist clean.
Do we have this at Levitas? Is it available to patients?
Not quite yet. We do, well, let me put it this way, we do have samples
Okay, good.
that we use so the patient can see how it's being used and how it should be used.
Okay.
But we don't actually sell in the practice. But we make sure that we give them the information where they can get it. But yeah. So
start early.
Start early.
Tell me about baby teeth and normal teeth. Is it the natural evolution that your teeth fall out and you have adult teeth?
Absolutely. So they do start to fall out at 6 years old.
Okay.
And it's usually the bottom ones first, and then the top ones, centrals. And at around the same time, the first molars, permanent molars, adult teeth, are coming through as well. So essentially, at 6, 7, they will have 6 new teeth. 6 new teeth that need to last. I often say to my little ones that those teeth has to last you until you're 100 years old.
Yeah.
So please look after them. Interestingly, the areas of decay often occurs on the first molars.
Okay.
Now, I often wondered why, and it wasn't until recently that I realized why, and that is because those teeth are first in mouth at 6 years old. A child of 6 years old does not have the manual dexterity to clean those teeth properly.
Interesting.
So that's why those teeth are the first to decay.
Oh, interesting.
And this is why, personally, I feel they're so important that the patient supervise their toothbrushing. And I would go as far as and say at least 3 times a week, and until they're about 8 years old, when they have the ability, well, the manual dexterity to use the brush correctly. Another thing I'm very passionate about is that adult or children, patients that come and see me, is that I often ask them to bring their own toothbrush in. And that's to ensure that what they're using is being used correctly, whether they're applying the right technique. And I have this example of a gentleman I saw once, and it was the first time we met. I had taken over from another hygienist in practice. So when I suggested to the gentleman that he bring the toothbrush for his next visit, he said, "What for? Yeah, I'm sure I can brush my teeth." And I said, "Oh, come on, Mr. Smith, please, humor me." And he did. He came back 3 months later and he brought his toothbrush. And it was quite sweet because he gave me the toothbrush. And I was about to teach him how to use the brush correctly because I couldn't understand, if he's using the electric toothbrush, why is there so much plaque there? And it turned out that the brush was not actually irritating.
Yes,
Hopefully that day I actually had a spare head that could fit in his toothbrush. So I was able to give him the toothbrush that actually worked and to show him how it actually worked. So he was very pleased, and so was I, because essentially
simple things like this.
By helping him, I also made my job easier for my next visit.
Yes. Well, I hear what you're saying. Certainly, with the possibility of a government policy of having supervised brushing of teeth in children in nurseries and schools. So it fits with what you're saying. If we can move on to the subject of mental health or anxiety in children or psychological issues and oral hygiene, chicken and egg, does the mental health issue lead to poor diet choices and then gingivitis? Can it be a sign that things are not right?
In my experience, and in fact, when I first qualified, I was very fortunate to work in the hospital where I train in Cardiff, and one of my postings was in special needs clinics. So I used to see a lot of patients with mental health issues, depressions, eating disorders, and unfortunately the first thing that goes, what they care the least for, is oral hygiene. So it is very important to help these people that are already vulnerable.
Yes.
And ensuring that essentially they're not going to accumulate even more problems.
Yes.
Because a toothache doesn't just stay as a toothache. It may lead to an abscess, which then leads to more invasive treatments such as root canal treatment. If that doesn't work, they may lose their tooth. If they lose their tooth, they may need an implant. Obviously, there's the financial aspect as well, that is not always possible to restore in the way that we want to restore it. And unfortunately with teeth, it's like a domino effect. Because of how they fit nicely like this. So if you lose one, essentially the others are going to start migrating.
Yes. They all rely on each other.
So this is why often when parents come to see us and there might be some decay on the baby teeth, the parent will say, and I'm not suggesting that the parent is wrong for saying it, because they might not know, but when they say, oh, but it's only a baby tooth, it will come out anyway. Yes, it will come out, but I don't think people appreciate that some of those teeth should stay in the mouth till that child is at least 13 years old.
Yes.
So the last few teeth to come out is at 12, 13. Obviously it differs from boy, girls, because if a child is losing their teeth too early, it has many implications, such as speech development, general development, the way they interact with their friends, because fortunately children are children. I don't think that's the nice way of saying it, but it's true, is that they may bully the child that is missing some teeth. It will affect their speech. It will also affect what they're eating.
Yes.
So it's important that the message that we give is that is baby teeth, would they have a role which is to maintain space and to guide the permanent teeth that are already forming.
Thank you very much. That was very helpful.
Thank you.
Our final episode is on the benefits of having an in-house medical and dental team working together.